In this video, we're going to take a look at plantar fasciitis and figure out what exactly it is and what we can do about it to help ourselves and our patients or those suffering with it. Plantar fasciitis is a type of tendinopathy at the anterior aspect of the calcaneus, or the front of the heel bone. This is a point where quite a few muscles attach. We call this collection of muscles the plantar fascia. But if you wanted to know exactly what they were, there's the quadratus plantae, extensor digiti minimi, abductor hallucis, and flexor digitorum brevis, to name a few. For various reasons of which we'll take a look at in this video, the tendon becomes overloaded and not fit for purpose, resulting in degradation and inflammation of the common tendon at the heel bone, giving us heel pain that we call plantar fasciitis. So what causes it? Well, there are a number of factors that need to be taken into consideration. Footwear, running surface, weight gain, mobility and strength of the ankle, foot and further up the kinetic chain all need to be taken into consideration. Ultimately, the tendon is complaining about having to do too much work. So the subjective factors mentioned are important, and figuring out what caused it can be helpful in the offloading period of rehabilitation. So how do we know that it's definitely plantar fasciitis? Well, a few factors. Often patients will say exactly the same thing. It's painful getting out of bed first thing in the morning and when putting weight through the affected foot, but can ease with movement and activity. It can be tender to touch on the point of pain. It's usually found in a very specific part of the foot, at the front of the heel, but it can vary from person to person, sometimes presenting more medial, sometimes more lateral. So what can we do about it? Well, the first and most important thing is to remove the contributing factors. Whether it's footwear, running surface, recent increased levels in activity, or recent weight gain, it's important to remove these if possible. Unfortunately, offloading alone rarely solves the problem of plantar fasciitis, so we need to look at some other options. Here we're going to take a look at some active and passive treatment modalities. An initial period of offloading can be beneficial, although advising against any weight-bearing movement at all is rarely helpful. Non-steroidal anti-inflammatory drugs, anti-inflammatories, can be useful in the short term to help get the patient through the acute phase, but long-term use is not recommended due to the gastrointestinal side effects. Ice may also help to alleviate acute pain, but this effect is only temporary. So it's recommended that the patient begins rehabilitative exercises ASAP. Remember, the common tendon for the plantar fascia is unhappy and for whatever reason no longer fit for purpose, so it needs to be strengthened. That's something that we can't do for the patient, unfortunately, but we can educate them and assess their current level of ability to give them a sensible starting base for the exercises that will get them out of this fix. To understand how to rehabilitate plantar fasciitis, we need to know a little bit about the windlass mechanism. A windlass is a pulley system designed to move heavy objects using leverage. In the toe-off stage of the gait cycle, the heel lifts with the toes still planted in extension. The windlass mechanism in gait refers to the tensioning of the plantar fascia during this movement that helps to propel us forwards. So, why all this talk of pulleys and leverage? Well, it's the position of the big toe during this movement that we're really interested in. It's here, where the muscles bound up in the plantar fascia are lengthened, that we need to begin to build the strength and adaptation needed to overcome plantar fasciitis. All that to say, strengthening the affected tissues should be done with the big toe in extension. Plantar flexion is the key here, but it must be accompanied with dorsiflexion or extension of the big toe. I use a folded towel for cushioning. It's also an easy way to increase or decrease the amount of extension used depending on the patient's tolerance. I do recommend a thorough foot and ankle assessment so you're not just blindly dishing out random exercises to the individual. Make the exercises and mobility work you prescribe specific to the patient. Don't forget to think about further up the chain. The plantar fascia is a continuation of the posterior fascia of the lower limb. So always remember to include the hamstrings and calves in the assessment process. Compare them to the non-affected side to see if there is a link and treat accordingly. Passive treatment. When it comes to treating the foot directly, you'll want to avoid massage on the point of pain. It's already inflamed, so try not to upset it any more than it already is. Massage into the rest of the plantar fascia and muscles that insert into the common tendon can be helpful, along with ankle, foot, and toe mobilizations, particularly the big toe. To stretch or not to stretch? So generally speaking, I'm not a fan of stretching the toes or the toe muscles for plantar fasciitis. Why? Well, because in most cases, the common tendon that inserts into the anterior calcaneus has been dragged into a lengthened position and it's complaining, it's not happy about it. So why stretch it and make it worse? That said, if the patient believes that it helps, if they get some relief from it from whatever reason, that's the most important part. So if they do, don't discourage them, but make sure that they're doing their strengthening work as well as the stretching. So earlier on I mentioned quick fixes and tips and tricks that can help to get a patient through a painful patch. Well, there are different ways of doing this which we'll look at now, but ultimately they all revolve around achieving the same thing, which is offloading that tendon, usually giving us some arch support of some kind to take some of the stress off the tendon that's not currently happy and causing the pain. Rigid tape can be good to get someone through an event or an upcoming match of some kind of sporting event. Or in the case of my bin man, he actually found this one very helpful, but he struggled to put it on himself. This gives us very rigid support in supporting the arch, alleviating some of the stretch from that tendon, and ultimately shortening the tendon. Kinesiology tape offers a similar support that can last for a few days up to a week, unlike the rigid tape, which is usually a one and done, single use affair. I'll always offer to show patients what I'm doing and send them an instructional video and a link to the tape off an online store of your choice if it's something they wanted to try in between appointments. This is usually the kind of technique that patients will be able to do themselves, so generally the most helpful and the most common one that I'll use. As I said before, these passive modalities are essentially crutches. They're ways of helping the patient get through a painful patch. The tried and tested way out of plantar fasciitis will come from the rehabilitation and strengthening of the soft tissue structures affected. And it's important that a form of plantar flexion with the big toe elevated is prescribed and progressed as and when appropriate. It's the only way out of this fix, folks. You may be wondering about cortisone or steroid injections. My views on these are that I advise against them. Don't get me wrong, they are fantastic at getting patients through a painful patch, much like the other modalities. However, there have been links to an increased risk of full rupture of the tendon with these. So maybe it's the only option for the patient, but just make sure that they are aware that there is an increased risk of full rupture. Plantar fasciitis can unfortunately take a while to clear up. In my experience, the sooner the patient gets to you, the quicker the problem tends to clear up. But no matter how long it's been around, as long as they're finding ways to make the lifestyle changes, to alleviate the inflammation, and to crucially strengthen that tendon with the big toe and dorsiflexion through plantar flexion of the ankle, they will climb out of the hole of plantar fasciitis. Thanks for watching. See you on the next one.